And thanks for being here this evening, to all of you. We're really delighted to be here to talk to you. My name's Kevin Crimmins, and I'm head of subject for adult nursing and also health and social care at the university. And my little bit of the talk will cover nursing generally, but really focused on adult nursing and mental health nursing, because those are the two fields of nursing that we cover here at Birmingham Newman University. Annabelle.
Thanks, Kevin. And when Kevin's finished talking about nursing primarily, I'm going to jump in and talk to you about allied health, what allied health professions are, and then specifically about physiotherapy, occupational therapy, and paramedic science, which are all degree programs that we offer at Newman. And just to be upfront, I'm a physiotherapist by background, and I'd love to take any questions that you've got at the end about the careers that you're thinking about.
Definitely. Thanks, Annabelle. So we'll see if the technology works now, and I'll press share.
That's great. Thanks, Kevin.
Brilliant. So as it says on the tin, that's us doing a talk on nursing and allied health courses and careers. And just a little note, talking about Newman, we are the smallest university in the area. And what that means is there's far more of a community feel with us. So much so that I will actually be able to name all the students that you see on our photographs. So there you can see Leah and Jess, who were two of our third year students. And also all the photographs in the section that I'm doing are taken within the skills teaching that forms part of the course. So it's an integral part of the course, because for me, nursing is very much a communication and action profession. And therefore, it's really, really vital that you get lots and lots of opportunities in our simulated ward spaces to get really, really proficient at the technical skills, so that then we can layer on how it feels to actually, say, be doing a blood pressure on a patient who's talking back to you, and you can't concentrate on the technique as much. So we give you plenty of opportunity in the university to practice those techniques so that you've really got them down pat before you go out on placement. So this is just a summary of the programs that we offer within the School of Nursing and Allied Health. So we can see two flavors of nursing there, adult nursing and mental health nursing. We also offer adult nursing with foundation year. For those, I'm sure that won't be anybody here, but if something goes wrong on, during your exams, and you don't quite get the tariff points that you need, we can offer you a foundation year, which is kind of a gentler introduction into the academic components of the course. We also offer a master's in adult nursing and mental health nursing. And you can see there as well our suite of allied health courses, namely physiotherapy, paramedic science, and occupational therapy. And as we said before, when I finish my little chunk on nursing, Annabelle will then cover the allied health professions. We also, if you'd like, get to the end of your years and you still don't quite know what you want, but you know you need a degree, we do offer health and social care at degree level as well. So little map, because not everybody has heard of Newman, Birmingham Newman University, and if you have, sometimes you don't know where it is. So what I'm going to do is take you, so this is the M5 going south down towards the West Country, and this is Franklin Services. So the service is just the other side of Birmingham, and then if you were a crow, you could fly about 1.5 miles and you would be at Birmingham Newman University. So it's in a place called Bartley Green, which is on the southern outskirts of Birmingham. Really, really close to a nice reservoir. So there's some nice walks and things around the university, because it's really important sometimes to get away and de-stress. And you can see we've got the Royal Orthopaedic Hospital there, and literally just over there is the Queen Elizabeth Hospital. So I hope those landmarks kind of provide you with a little bit of triangulation as to where you can find us. So I'll talk to you about adult nursing and a little bit about my background. I'm in my 43rd year as an adult nurse, and I know, I don't look old enough. The lighting I've set up to look very, very flattering. But the reason I say that is because any health job has so many career possibilities within it, whether that be physio, whether that be OT, and certainly in nursing and adult nursing. I started in the army. I was in the army for 30 years. Clinically, I chose initially to specialize in burns and plastic surgery. And I did that for about 14 or 15 years. And then I kind of pivoted into critical care nursing. And again, did that for a while. And from about 2006, I decided my passion was working with students and teaching. So I was able to move into teaching full time in a university, initially at Birmingham City University, and then latterly at Birmingham Newman. And as I say, the reason I'm saying that isn't to say, oh, look at me. It's just to show you there's no way you could get bored in any of these careers. And the other good thing is the health service is very, very good at developing its staff. And for each of those courses I did, actually, I was still paid in my role while I took on these new roles. My daughter, who's a nurse, obviously very proud. She works at the Women's Hospital working with premature babies. She's just finished an MSc at Salford University in neonatal advanced practice. And actually, her employer paid for the course and also her travel to be able to get up and down. So that's what I'm saying is these professions, once you've graduated and you've started, particularly with the health service, they are very good at developing staff into areas that they feel they need. The other two fields of nursing are child nursing and learning disabilities nursing. We don't actually do those at Birmingham Newman, but there are universities on our patch that do those courses. So if that's your passion, please pursue it. Similarly, we don't do midwifery at Birmingham Newman, but certainly Birmingham City University, University of Birmingham, Wolverhampton, Coventry University all do those courses and those fields. What I would say, top tip, if you are interested in midwifery and you haven't done your personal statement yet, focus on care of the woman and empowering the woman. Do not talk about babies, because if you talk about babies, that's not what midwifery is about. At a delivery, if there's difficulties, the baby's handed to a pediatric nurse, a children's nurse and doctor who would be on standby. Midwifery is all about the care and the empowerment of the woman. So that's just a little bonus for coming along here to help you on your way if you want to be a midwife. So adult nursing, it's one of the broadest professions in that adult nurses are there caring for adults of all ages. So with a variety of health conditions, so from minor injuries and ailments to really complex stuff. So nursing's a family business of mine. For example, my wife is a primary care nurse. So actually. She works in a GP practice close to you. She actually works at Lion Health, which I know is your nearest GP surgery. And she loves that job. Her specialism is particularly diabetes and supporting people with diabetes who live in the community. But everything else that people might go and see their GP for, there will be an adult nurse there to support that care. Right through to, as I say, my background was critical care nursing, but palliative care, which is looking for people who are coming to the end of their life, working in hospices. There are just so many different career paths. But our focus as a nurse, it's about that communication. It's about that genuine passion for caring for people, putting them at their ease so that they're going to trust you with the information we need to be able to look after them. And then looking after them is very, very complex. We're a profession in our own right. So, for example, if I'm a critical care nurse and I'm looking at a patient and I think there's a danger of deterioration, I need to be able to know what I'm looking for. I need to understand that underlying physiology, because I need to predict where I think the trajectory of that illness is going. In an acute, do I think they're heading towards a heart attack or cardiac arrest? Is there anything I can do to intervene, or do I need to get assistance? And when that assistance arrives, what do I think they'll need? And that's why, we offer these courses at university level, because the absolute art of being a nurse is being able to blend all of that communication with all of that technical knowledge that you need to be able to diagnose, keep the patient safe. For example, as an intensive care nurse, I could be looking after a patient who had left in the morning. They'd had breakfast with their family, kissed their partner goodbye. They've had an accident on the way to work. They've got really, really life-changing injuries, and they go through the emergency department and end up with me on intensive care. It's usually then that somebody like me might have to make a call to the next of kin and break that news. And therefore, I need the skills to be able to be very, very clear with the information I'm given, but with enough compassion and enough be able to calm the person so that they don't hurtle to hospital and put themselves in danger. Then when they arrive at the hospital, I'll probably meet them outside the intensive care, because anybody who's watched Casualty and those sort of programs knows that there'll be lots of monitors and machines that go bleep. And it's important that I don't make this person really, really scared before they've even gone in and seen their loved one. So I'll go outside and explain what's going on. And part of my role is, as well as the technical stuff of making sure that the drugs are there, is also making sure that the patient's had a wash. If they happen to soil themselves because they're unconscious, that's down to me as a nurse with a healthcare support worker to clean that patient up. And for me, that's the privilege of just providing that total care for the patient. Because when that worried relative goes into the room, they're going to look at the machines, yes, but they want to look at the person in the bed. They want to know that they're cared for. And it's my privilege to be at that bedside and give that care as a substitute for their family. And as we go on day by day, as the person's there, usually if I'm looking after an intensive care patient, I've got a very worried relative at the bedside. And therefore, I've got to be able to communicate with that person and support them emotionally, as there's always a bit of a roller coaster. So what I'm trying to do is give you a few examples of where the role of the nurse is. And certainly at the university, we focus to make sure that you've got those communications, those skills, as well as being able to have that physiological knowledge, that drug knowledge, to be able to effectively care for somebody. But that's sort of like how nursing works. But all of these things, particularly someone like critical care or even on the wards, nobody works in isolation. You know, one of the privileges for me about nursing is that we spend the most time with the patients, certainly when they're in hospital, and we kind of advocate for those patients. But getting somebody well, particularly somebody who's seriously injured, is very much a team activity. And certainly in critical care, there will be times when the doctors come in to have a look, see how the patient's progressing, talk to me about how I'm finding the patients progressing. They might be on the breathing machine, for example, and we talk together about a plan as to how we're going to wean them off of that breathing machine. We might also have a dietitian that joins, because, well, if a patient's going to be unconscious for a few days, we've still got to feed them. So there would be a dietitian. There would certainly be a physiotherapist who would come in, because all of those joints that the patient's not using still have to move to make sure they don't become stiff. And also, if they've got a breathing tube, it's very difficult for them to cough and move any secretions on the lungs. And certainly a chest physiotherapist will be helping us with that. So very much adult nurses are a key part of that multidisciplinary team, but there is a multidisciplinary team looking after that patient. And there's just some of the care environments that you might find nurses. So I spent most of my career in critical care, in acute care, but there's community care. You know, more and more we are seeing very, very ill patients being looked after in the community. Because of the way the NHS has gone, people are spending less and less time in hospital. I'll give you a little example. When I first started nursing, way back when Florence Nightingale was still nursing in the early 1980s, if somebody needed a replacement hip, when they had the operation, they had to stay in bed for 10 days before they even thought of getting them up. And then it was a long process to get home. Nowadays, it can be even the same day, but definitely the next day, that Annabelle and her team of physiotherapists would be coming along to get the patient out of bed and start thinking about what they need to do to be safely discharged. Is it that they need to be able to go up and down stairs? But certainly within 3 to 5 days, that patient will be home. And sometimes it's as soon as, you know, the day after or the day after that. My wife, as I say, she's a primary care nurse, but she focuses on diabetes, which is obviously a long-term condition. And therefore, there are lots of nurses who specialize in those individual long-term conditions. And palliative care, you know, it's a real privilege to look after a patient and their family towards the end of somebody's life and being there. Probably the most common palliative care, I'm sure you've all heard of Macmillan nurses. That's an example of palliative care nurses. But certainly adult nurses, you'll see sort of popping up and working everywhere. So that is another picture of one of our skills sessions with some dodgy fella doing some teaching there. There, the students are looking at different ways that we can deliver oxygen to patients. And one of the things about Newman University is when you're actually in uni time doing modules, you would spend 3.5 hours a week in our clinical areas learning those basic skills before you actually then go on placement and start using them. What you'll see on the screen is actually some examples of where you'll find adult nurses working. So you see there is a very, very broad and diverse career there available. So I'm going to talk briefly now about mental health nurses. And mental health nurses are there particularly to support people who might have acute or long-term mental health issues. And again, the whole spectrum is right from what we say the cradle to the grave. So, for example, there is a possibility that shortly after giving birth, that some women can suffer from what's known as postpartum depression or postpartum psychosis, where, you know, because of the hormone imbalance, it triggers something in the brain that makes them think either their baby is a danger to them, or everything around is a danger to their baby, and it can make them act in very, very unpredictable ways. Mental health nurses would support these mothers, and indeed there are specialist units where the mother and baby can be kept together while they're able to treat and manage the condition until such a time as the mum feels more balanced and we're able to get a home again. But ever more, we are more aware of mental health illness, and we're seeing more and more mental health type conditions such as anxiety, eating disorders in children and young people, and therefore child and adolescent mental health is quite a large specialism now, and you would find mental health nurses who then specialize in child and adolescent mental health. A lot of mental health takes place in the community. Probably only between 10 and 15% of mental health patients at any one time are actually in hospital for their mental health condition. So most mental health nurses work with patients out in the community, and you can have some quite unwell patients who might need to be visited or to see the nurse twice a day to start with, while they're sort of balancing their medications, and they can get the patients on a more even keel. Some patients might have check-ins once or twice a week. So most of it is, and then there's specialized services for all sorts of disorders. So for example, eating disorders, there might be a service for that. There is a specialized service that works with homeless people who also have mental health issues, who actually go out to visit these patients where they are. So lots and lots of different areas. Two of our team, including Alexis, who's the head of subject for mental health, most of their background was in the prison service, working with people with mental health issues who are actually in jail. And that is quite a significant proportion of the prison population who are living with some sort of mental health issue. I'm happy to share with you that I suffer from depression and anxiety, which is under control. I have to take medication every day for it, but I know that if I have a bit of a bad few weeks and I'm not managing to manage that myself, I've got a mental health nurse that I can refer myself to and have some sessions with them until I'm feeling better. We've also got mental health nurses who might specialize in things like cognitive behavioral therapy. So again, it is a very, very broad profession with lots and lots of different avenues that you can go down. And here is a few examples of where you might find mental health nurses working. So mental health and adult nursing, the way we do it at BCU, not BCU, Birmingham Newman. I used to work at BCU. At Birmingham Newman, is the way we develop the course is the first half of the course is what we call core. And we make no apologies that both the adult field students and mental health students all do the same modules and the same skills sessions, because there are real statistics that show most people with a chronic mental health condition also have a chronic physical health condition. And actually, the mortality, the life expectancy of somebody with a chronic mental health condition is about 10 years sooner than somebody without a chronic mental health condition. And that's because sometimes these physical health conditions aren't picked up very, very quickly. So what we want is we want our mental health nurse graduates feel very, very comfortable dealing with physical health that might happen to their patients. And in the same way, if I go into any ward, probably about 20% of the patients will have some sort of mental health issue that they're living with. And we want our adult field nurses feeling very, very confident to facilitate the needs of those patients while they're with them in their service. So that's one of the things about our course is we make sure that everything is core for the first 18 months. So the course is a 3-year course, and at the end of it, you get 2 things. The right to put BSc Hons after your name, but also to be registered with the Nursing and Midwifery Council. So it is 3 years full time with a foundation year if you need it. And it's a mix of theory learning and practice learning. So it's 50% of your time is in university, 50% of your time is actually out on placement. And kind of the way we do it is we break your year into blocks. Green here is the induction week. Anything you see in blue is when you're in university studying your modules. Anything on yellow is when you go out on placement. And we don't sort of tend to do 2 weeks in uni, 2 days in uni, 1 day on placement, because people get very confused. So what happens, we would allocate you to a ward or a service for those chunks of time. In red is holiday, and these pink times is when the assignments are due. Those are some of the organizations we work with. And there's a little bit of information on the type of salaries, but even that now is about 2 years out of date. So salaries will have increased in that time. So, you know, the basic for a band 5 nurse on qualification, I think, is around £28,500 at the moment. Why nursing at Newman? I told you about the smaller class sizes. So again, there's some of our students in the skills. Our curriculum was developed with our practice partners. We make sure even when we're doing the core that there's time when mental health and adult will break off to make sure that you're feeling that you're part of nursing. So for instance, we could talk about respiratory physiology in the morning, and then the adult nurses might focus on something like asthma, and maybe the mental health nurses will look at a condition like anxiety, and anxiety can make the heart and the respiratory rate go up, and look at how that might impact on how that makes the patient feel. And I'm gonna leave it here because I can talk forever about these things, but I want Annabelle to have some time to talk about the awesome courses that she runs as well.
Thanks, Kevin. I thought we were going to go right up until the end then. I was sitting there waiting to jump in. Okay, so everybody, I'm going to talk to you about allied health professions. So as I said previously, my role is head of subject for allied health at Birmingham Newman University. So I look after our allied health provision, but I'm a physiotherapist by background. So Kevin, next slide, please. Just wanted to kind of clear up a bit of an understanding about what the term allied health means. So when we look up allied in the dictionary, it tends to come up with something along the lines of connected to or related to. So when we're thinking about that in a healthcare perspective, it's connected or relating to delivering healthcare. And importantly, allied health doesn't cover nursing profession that Kevin's just spoken about, and it doesn't cover the medical profession, so doctors, which are regulated by the General Medical Council. Instead, the allied health professions, of which there are 14 within the NHS and 14 registered allied health professions, we are the third largest workforce in the NHS. So behind doctors and nurses, we then have the group called allied health. So I'm just going to show you some of those allied health professions, and some of them you might be really familiar with. Others you might think, oh goodness, I didn't know that existed, but that's something I want to find out more about. So on that, you will see we have occupational therapists, which I'm going to talk to you about in a minute. We have physiotherapists, and we have paramedics, which are probably some of the most common allied health professionals that you will have seen, either from things you've seen on the television, from an interest that you've shown, or from family and friends. We also have dietitians, which really focus on maximising the health and well-being from somebody from a nutritional point of view, whether that's because they've had surgery or they've got a long-term health condition, or whether they're trying to lose weight or gain weight in some instances as well. We also have art therapists and music therapists and drama therapists, which use art, drama and music to kind of improve people's health and well-being. We also have on there podiatrists, and podiatrists work with feet and gait, walking, and also biomechanics. So people's how people walk, is it healthy? Do they need things like insoles or orthotics in their shoes to make sure that they're safe and stable? We have operating department practitioners who work specifically within theatres, supporting anaesthetists. So if that's a real area of yours and you'd rather work with unconscious patients, then that might be something that you want to kind of explore if you're interested in allied health. So if you're a musician, you're an artist, there might be something within the allied health professions that you want to explain or explore some more. Okay, next slide, please. Okay, so let's talk specifically about Birmingham Newman just for a little bit. So we have 3 courses, and these are all 3-year full-time programs. So we have occupational therapy, and I was going to get people to put it in the chat, but I think probably we'll keep going. Occupational therapists do anything which involves what people want to do with their lives. So when we're talking about occupation, that might be something like brushing your teeth. It might be something like walking down the stairs. It might be something like driving your car or going to the gym or going to work. So occupational therapists work on a one-to-one or a group basis with individuals from very, very young to very, very old to try and maximise what they can do to let them achieve what they want to achieve. They work in a whole host of settings. So they work within the NHS. They might be, if you think about Kevin's example, he talked about hip replacements. So what an occupational therapist would do is they would see the patient before they went to theatre to assess their home environment, to talk through what they were worried about, what challenges they might have. And then they might see them after theatre before they went home to make sure that they could get on and off their toilet, they could get up and down the stairs, and they had any equipment that they needed at home to support them in their recovery. An occupational therapist is a profession which is, absolutely integral to all these interprofessional teams that we've been talking about. The NHS can't function without occupational therapists. Children wouldn't be able to maximise their learning at school without occupational therapists. So it's a really, really important profession, and something you might want to consider if you really like that relationship with patients. You like working with very young people, you like working with very old people, and you've got that patience and that commitment to support them through their journey to recovery. We also do a BSc Honours in Paramedic Science, which once again is a 3-year full-time programme. Now, you probably all know what paramedics do, or you might think you all know what paramedics do. I mean, if you ring 999, I hope you never have to, but if you do that, you are likely to, after an assessment, have a double crewed ambulance turn up at your door, which would be crewed by a paramedic. And paramedics provide the rapid assessment in kind of time critical situations, emergency situations, And then they make a diagnosis, they provide a course of action, and then they transport, if necessary, to hospital, or they might deliver the treatment to enable the person to stay at home. Sometimes if you call 999, then they decide you don't require an ambulance and you'll be directed to 111. And once again, you might speak to a paramedic over the telephone who will guide you through what you need to do. They will ask you some questions about the condition that you're suffering from, and then they will work with you to come up with a solution, which might mean going to see your GP or going to see a pharmacist. And paramedics also work within GP surgeries as that first point of assessment. And they also work within hospitals, within A&E as well, to provide that rapid assessment using their skills that they have. So once again, a whole range of skills needed of a paramedic, and I'll talk to you a little bit about that in a minute. And then we have a BSc Honours in Physiotherapy, which is once again a 3-year full-time programme. Now, physiotherapists work with individuals and groups from neonates, so really tiny babies who are born prematurely, all the way up until end-of-life care. And they really work with individuals to both maximise their function, but also improve their function. So if you've ever damaged your knee playing football, which is a real common one, or you've had a relative who's had a fall, they will see a physiotherapist as part of that recovery. You will see some pictures at the bottom there, and that shows a physiotherapist working with a client in the hydrotherapy pool. So using the mode of water to kind of improve balance, improve strength, improve endurance for that individual, which then translates to them being able to do more things on land. Physios do work within sports, and I get a lot of personal statements saying I really, really want to work within sports, which is great. They do work, but less than 1% of physiotherapists work within elite sports. So that's something to remember. The majority of physios, paramedics and occupational therapists all work with middle to older adults, and that falls the majority of their job. Now, all of these courses are really, really practical. So as Kevin mentioned earlier, you have a mix of theory, so that's time spent within a university setting, but you also have over 1,100 hours in each of the programmes, which is based with our practice partners. So working at different hospitals, working within voluntary organisations. It might be working at a hospice, it might be working with a sports team, it might be working with West Midlands Ambulance Service, or working at Amazon, looking at some of their processes there. So it's a really exciting programme of study, whichever one of those allied health professions you choose. Kevin, next slide, please. Okay, so as I say, these are very hands-on professions. All of the allied health professions, any of those 14 are all really, really hands-on. So to be successful and to be able to enjoy a career in allied health, which is what this is all about, you need to be passionate about working with people of all ages. So as I say, from young children to older adults. It shouldn't just be focused on one area that you're particularly interested. And you should have a keen eye and a keen interest in yourself to promote good health. You know, why do people need to be healthy? Why do you want people to be healthy? And also every day that you work as an allied health profession is going to be different. No two patients are ever the same. They all have different backgrounds. They all have different ways of communicating. They all have different physical problems. They all have different mental health problems. So working in allied health is like putting a massive jigsaw piece together. You have to work with different pieces of information that you get from lots of different people to put it all together to solve that problem, to find a solution that works for the patient and their family. You also need to be a good motivator. If any of you have ever had somebody say to you, come on, you've got to get out of bed and do some revision, or you need to go and fill in your UCAS form, and you're just not feeling the love for that, you need to be able to say to that person, come on, you've got to do this. And that's the same with patients. You will have patients that don't want to get out of bed. You'll have patients that don't want to engage in activities because they're in pain or they're uncomfortable. So you need to be able to work with them to address their barriers, to overcome those barriers so that you can help them to achieve what they would like to achieve. And people, you need to be interested in people and also in how the human body functions as well. So with any of those 14 allied health professions, the basis is human biology, how the body works, how the body's structured. in both health and also how the body's structured in disease as well. So if you love human biology, you love PE, got that real interest or sport outside of university, or you love listening to people's conversations, you might well find that allied health really, really works for you. Next slide, please. Okay, so similar to nursing, there are lots of places that do allied health courses. And, really think when you're going to look around universities over the summer or next year or whenever that is, think about why you might feel comfortable studying at one particular place. Now, Newman is all about a personalised approach to your education. So we have really small class sizes. Some physiotherapy courses, for example, have 180 people in a lecture theatre. Our class size is 35. So if you like to be invisible and you want to hide at the back of a lecture theatre and let nobody know that you're there, probably Newman isn't the place for you. But you will find some universities that you can hide within. So, go and find those universities. We've got a really brand new curriculum, and they've been developed with our practice partners. So with practicing physios or paramedics or occupational therapists, and also our experts by experience, which is our service users and carers groups. So these are individuals that engage in health delivery. So they might have had an operation, or they might have had a relative who has dementia or been in a mental health unit. So they tell us what worked, what was good, what did they like about their care. And by understanding what's important to them, we can make sure that our students and our future physios, our future OTs, our future paramedics understand what really is important to patient care. We have interprofessional education throughout all 3 years of the programme. So you don't just work with physios or OTs, you work with mental health nurses, adult nurses, and all of the other allied health professions. And we've got really, really good facilities at Newman. So come and have a look when you're next around. Really importantly for us, practice placement. So this is times when you spend with the ambulance service if you're doing paramedic science, or with your, for example, the NHS if you're doing physio and OT. You have practice placements in each of your 3 years of study. So we know that when you come to university, you don't necessarily want to sit and be listening to PowerPoints and having lots of time being talked at. You actually want to get out there and be doing the job that you've come to train to do. So we get you out there in all 3 years of your study, so you get that real mix between theory and practice. And as Kev mentioned earlier, Newman is all about you as a citizen, as about a partner. We don't just tell you stuff and then you go home at the end of the day. It's about you belonging in somewhere and feeling safe and secure and actually enjoying your time that you're spending with us at Newman. Next slide, please, Kev. Okay, and you've seen this before from a nursing perspective, but as I say, the courses are that real mix of theory and practice. So you've got your blue blocks, which are time in university, your yellow blocks, which are time out in practice partners. And I just want to draw your attention to the pink blocks, because these are your assessment weeks. So for those of you, and I think the majority of you are doing A-levels, aren't you? You will have your main kind of assessment point at the end of your second year of study. So you just get your one big set of exams. I know you have mocks in between as well, but your main exams end at the end of your second year. For the courses at Newman, we have more of a continual assessment period. So we will have a mix of practical exams, we'll have a mix of presentations, we'll have a case study, we'll have some essays. So there's a whole range of assessments to suit whichever learning style that you have. And also by having them spread throughout the years, you don't have that big pinch point, that big pressure point at the end of the year of study. You kind of split that load throughout the course. So once again, when you're looking at other universities as well, ask about their assessments as well, because some of you, if you love exams, you want to be going to a university where they do more exams than they do practical assessments. Whereas if you love practical assessments, then once again, choose universities that kind of match your assessment style. Kev, next slide, please. Okay, and you know where you are in Stourbridge, that we're really, really well suited and sorted with placement. So we've got a huge range of placements that you would go to as a student at Birmingham Newman. And what we try and do is, depending on where you live, we try and give you the right experience that you need to qualify as a physiotherapist or an occupational therapist or a paramedic at the end of 3 years, but closest to where you live. So what we don't want to be doing is sending you miles and miles to Stoke or down to Stratford if we've got placements which are really close to you in Stourbridge. Okay, the next slide, please. So whatever course you decide to do, whether that's an allied health course or a nursing course, joining the School of Nursing and Allied Health at Newman is a real key role, because what you're doing in any of those professions is you're enabling people to improve their health, their well-being, and ultimately their quality of life. You're helping people to live their best life. And the joy about and the real privilege at working within these professions is that you make a real difference to people's lives when they need it most. So if they're having surgery, or if they've had an accident, or they've got an illness, they can feel really down, and your care, your person-centered care, can really make the difference to them. And people often remember good care more than they remember bad care more than they do good care. So bad care can really affect individuals. So by you giving good care, being a fantastic allied health professional, a fantastic nurse, you can really make a difference to them. Every day is different. As I said, every patient is different. Every procedure is different. Every treatment regime, every assessment findings are different. So if you want to be kept on your toes all the time, and you don't like routine, and you don't like things becoming boring or becoming predictable, then you might want to choose one of the professions that we've talked about this evening. And also there's a real mix of working as part of a team, so working with other nurses or other physios or other paramedics, but also having the ability to make your own decisions. So all of the allied health professions, any of those 14, are autonomous. That means people don't tell us what to do. We make our own decisions. We're responsible for our own decisions. So once again, you're really having to think about what you do all of the time. Think about that big jigsaw puzzle, that finding solutions and coming up with answers to those problems. And also there's massive career choices and progression within the nursing and allied health fields as well. Quite often people start within the NHS, but then they might go into different private practice. They might set up a business on their own. They might go and work abroad. So there are lots of career choices for you, and lots of chances to progress in terms of money, so financial, but also in terms of the skill set and the responsibility that you have as well. Kevin, next slide, please. Kev, do you want to talk about the financial support for allied health and nursing courses? Oh, you're on mute, Kev.
You're on mute.
Apologies. So the first thing to note there is, because all of these courses feed into the NHS give a bursary to students every year. What does a bursary mean? It's money that you don't have to pay back. So if you were doing a BSc course in adult nursing, and I think, Annabelle, all of the allied health professions, it's £5,000 per year that you're on the course, which they usually break into 3 chunks, paid directly to you. If it was that you had young children, they would also give you £2,000 towards your child costs, and you're able to claim your expenses to and from placement. You would also be eligible to apply to the student finance company for your tuition fees to be paid, and then also a maintenance element, and that is money that you need to live on while you're doing the course. If it's a loan, they have to be paid back, but the maintenance element can be a grant depending on the income in the house where you live in. So if your parents both got really, really good jobs, you're probably gonna get that as a loan. If you're in a family that maybe has credit support, tax credits, then there's a chance that you may get that maintenance element as a grant that doesn't have to be paid back. And there's more information if you Google the funding clinic. That's a website set up specifically for students who are doing healthcare courses at university, which will give you more information about that. We have won some awards. One of the ones that we're very, very pleased about is being #1 in the West Midlands for listening to our student voice and the learning opportunities. And that was given by our existing third-year students. We're also #1 in the country, according to the Times, for social inclusion. So that means welcoming students from all backgrounds and making them feel welcome at our university. And there's just some of the other awards we've won. I'm going to stop the presentation there because I took a huge chunk of time to start with, because I get very passionate about nursing, just as Annabelle gets very, very passionate about allied health, and we work together. You know, the courses see a lot of each other at the university, but we do have some time for a few questions if anybody's got them.
Yes, and thank you very much indeed, Kevin and Annabelle. That's absolutely brilliant understanding, I think, of both the adult nursing, the mental health nursing, and the allied professions, and particularly in Newman. Myself and Faye have been around Newman University, and I would encourage all students to go and visit, go to an open day, to make comparisons with other universities, but to go and ask questions and speak to current students, because they are the best people to tell you about the experience of being a student in one of these courses. We have had a couple of questions in advance, but please, students, do add any into the chat. I can see that we are getting some typing in there already. One of those questions to both of you is about work experience, bearing in mind the majority of students online this evening are in year 12. What can they be doing at this stage in addition to their academic studies to begin to build their portfolio of skills that will make a good application and interview? That would be really helpful.
Annabelle, do you want to go first?
Yeah, sure. So we do kind of advise people to get a work experience, but that's primarily to ensure they understand what profession they're trying to get into. But we also know it's really, really difficult. So from a work experience point of view, if you go on the home pages of the majority of the trusts in the local area, if you put in the search bar work experience, they will bring up their opportunities and the programs that you can apply for. But don't limit your chances to that. Really, the best work experience that you can get is exploring the profession, and that might be looking at some specific websites, and I'll pop those in the chat for you. So the Chartered Society of Physiotherapists, the Royal College of Occupational Therapists, it's gone from me, the paramedics body as well. So we'll put those in the chat, but also any experience that you can get in a customer facing role. So that might be doing some work experience in a cafe or in a school, or having a part-time job in one of those areas as well, just so that you can communicate with people, because nursing and allied health is all about communication. If you communicate with people well, you're happy, you're confident talking to people, you can listen well as well, then those are all really important skills that will help your application.
Super, that's absolutely great, and mirrors very much what we encourage students to do. Within the pathway, we do advertise our opportunities that we get for work experience. We have a work experience coordinator and work experience workshops here, in which you can come along, students, to ask about where you might work, what kind of skills you might be needing, and to try and replicate those in some kind of an experience, as you say, whether that's in a healthcare profession setting or a completely different setting where you gain those transferable skills. I also like the idea, I think, Kevin, you mentioned the word privilege, and I think it's a really important thing that students understand that actually this is about people. It's a people-centred set of professions that you would be applying for, and therefore demonstrating not just your academic ability in your sciences or whatever you're studying, but also to demonstrate those skills. Team working, you've talked about caring and communication and those multidisciplinary. So there's a raft of different places that students can in fact find that work experience. Yes, Kevin.
So I would say we read up the personal statements, because these professions are so public facing. all of them have an interview attached. Whatever university you go to, there would be an interview to get into any of these professions. Now, some of the best personal statements that I've read are from students who might have worked at McDonald's or in Primark or somewhere like that, and are able to sort of think about what are the transferable skills that you would need in one of these professions. So, for example, I've had somebody at who worked at McDonald's tell me, I'm really, really good at establishing a rapport with customers very, very quickly. And sometimes they might get the wrong sauce, and so I have to resolve complaints, and having the knack of being able to understand that those skills that you've gained in your job are going to be really, really important in the profession that you're going for. That's what we're looking for. It's so it could be any sort of experience where you're interfacing with the public, but the real trick is being able to think about, so what are those skills and why do I think they might be important in being a physio or a paramedic or a nurse?
That's brilliant. And I think the other things that both of you touched on, Kevin and Annabelle, about choosing the right university to go to, is about thinking about that sort of very much smaller class sizes where people actually are going to be well known, well looked after, but also not, can't fight shy of getting involved. And I think, again, it's kind of looking at those different universities. And as I say, I think the open days, and I know Faye's been putting some smashing links in for students, but go and visit the open days, go and make some comparisons, go and talk to the lecturers like Kevin and Annabelle, and also talk to students and find out what their real experiences are. Yes, Kevin.
Sorry, Louise, one last thing. I want to give the students some advice when you're going around those open days. So every university will have the nice modern wards and kitchen facilities and things that you'll see at our university. But the top question you need to ask is, how often will I use them? Will it be on a weekly basis or a monthly basis? Because, for example, at Newman, you'll be in those sort of places working every week you're in university. But some of the bigger universities where the cohorts are really big are too big to actually be able to get everybody through on a weekly basis. So that's another of those areas that you kind of want to think about the value that you're getting for the money that you're paying. So that's one of the questions I'd be asking. But my top tip is always, when you go for interview, when you go to an open day, it's kind of, you're seeing everybody in their Sunday best. But when you go for interview, it's usually a normal working day in the university. And I would always say, go and have a coffee. Everybody's got a Costa or a Starbucks in the uni, and actually sit down and just listen to the conversations from the other students and think, is this my sort of place? Would I feel comfortable here? Would I do my best work here?
That's smashing. Thank you. Annabelle, any last tips? And then we have to go, but any last tips from you, please, if you've got one thing that you could share with students?
I would say we do read personal statements, so please don't assume people don't use personal statements. So please don't list a whole raft of things that you've done. Try and apply those to kind of some of the skills and attributes that and behaviours that you would need as an allied health professional or a nurse. And if just get your tutors to check those, because I'm sure they do anyway, but as I say, sell yourself.
That's brilliant. Thank you very much indeed. I'm sure our students have really benefited from that, and we will be circulating the recording to the students online, but also to those who are on the pathway who were not able to come this evening. Kevin and Annabelle, thank you so much. If any of the students have any questions following on from this, we'll forward them on to you. Students, thank you for attending. Please make sure that you come along to the Careers Fair on Wednesday, the 4th of February evening, along with parents, where we've got many of the healthcare professions represented, along with other professions. We've got nearly 70 stands on that evening, so from 6 till 8:15. Please come along, talk to people who are in those professions, and please go and visit Newman and the other universities to make those comparisons and choose the right course and right university. Kevin and Annabelle, thank you so much for your time this evening, and thank you, students, for coming online. We look forward to seeing you both soon, Kevin and Annabelle. Thank you. All the very best. Thank you. Good night to you all. Thank you.